Okay, so my name is Naomi Watson and I work in Wells as a senior lecturer and deputy associate dean. And thank you everyone for coming along to our presentation. And basically, as our title here tells you, we're going to be talking about nursing curriculums and how they were actually impacted by our recent pandemic and how what we proceeded to do in terms of the scoping review. Next slide, Joe. Thank you. So the idea for this project came out of a level 2 theory module team on our undergraduate nursing program. And this was during the first lockdown when our government, some of you may or may not be aware, if you're sort of related to the healthcare area, you'd probably be aware that our government asked our nurses, student nurses in particular, to come back into clinical practice to help them, to help them fight the pandemic. And basically, the NMC, the Nursing and Midwifery Council, decided to respond to that with an emergency curriculum. So the education providers, of course, had to respond as well, because in terms of the NMC, the program that's actually provided for nurses generally, in terms of becoming registered as practitioners, involves 50% theory and 50% clinical practice. And we had to look at reducing it. We were actually asked to look at reducing it to 80% practice versus 20% theoretical input. So we were charged as a team in the nursing, on this nursing module, to actually look at this and ensure that we could actually ensure that students could actually be helped and assisted in terms of their program. So the team felt that it had some impact. We did this. We reduced the curriculum. We assisted students with getting through the work, and it was actually available to all students. So not all students actually went on to help the government. Some did and some didn't, but all students had access to this reduced emergency curriculum, if you like, that we put together as a team, and it came out of this one small team. So when we'd actually done that work and the students had actually reported on their outputs, we felt that there was some impact, but we had no evidence. And this is really where our project came from. Next slide, Joe, please. So basically what we did when we came up with the project idea, we decided to look at the literature in terms of what was out there, the extent and the range of the literature relating to student nurses, the curriculums, and how the emergency healthcare responses had actually panned out, if you like. We also wanted to explore the findings within that literature, and we wanted to try and position them within the broader context of the ongoing impact on nursing curriculums. And this really was general. We also specifically wanted to see whether there were any gaps in the literature. Next slide, Joe. So to do that, we decided to use the Johanna Briggs Institute methodology. Some of you may be aware of that as well. And we actually looked at that framework because we thought it was going to give us an excellent structure in terms of identifying what was actually available and how it related to what we wanted to find out. We only looked at English language studies from 2019 to 2021. And we used the search strategy, which actually included specific search terms, to search 5 online databases: CINAHL, ProQuest, PubMed, Ovid, and Google Scholar. We then decided to use a narrative approach to synthesize the papers that were identified. And the papers were reviewed by 2 of our team members. Next slide, Joe.
Is this where I take over or you continue on? Yeah, okay. So after we'd conducted the database searches, we came up with 356 papers. And as Naomi mentioned, actually we were looking at a very short period of about 14 months in total, where usually for database searches, you're looking at 10 years or more. So actually, what it indicates is that there was a lot of papers were published in that period, which looked at nursing and COVID-19 in some fashion. We had 260 papers after we removed the duplicates, and when we screened by title and abstract, we removed 180 papers, largely because they dealt with virtual simulation and telemedicine, which was by far the largest number of papers we found. Not relevant to us, but there was a lot of work which was done on that. We were left with 80 full text papers to screen by full text. 64 we excluded, in this case largely because they focused on disruptions in clinical practice rather than on nursing curriculums. This left us 16 papers to include for the review, and they ran across qualitative studies, mixed method studies, and in particular reflective editorial by senior nurses informed by prior empirical studies, which after some discussion we decided to include the strongest of these in our scoping review. And the key findings we found were that selected papers emphasized healthcare responses to COVID-19 had a large impact on students' mental health and well-being. This was actually across the globe. This broke down actually remarkably similarly. About 30% of students were very, very seriously impacted by the changes to their curriculums. About 30%, about a third were fearful, made fearful, and about a third were remarkably stoic in the studies that we found. Unfortunately, none of the studies, and we'll come on to this in the limitations, really beyond describing nursing students' initial responses didn't really delve down into the characteristics that might suggest why one belonged in one third population and the other third or the other third. But the key thing for most of the student nurses who were studied was their fears for themselves and their families as frontline staff fighting against the pandemic. In particular across the globe, the rejection of terms such as angels and the desire to be seen as professionals. There were a lot of anxieties, particularly in Mediterranean countries and in some other countries about future career prospects as registered nurses whose trainings had been impacted by the transition to blended learning and emergency clinical practice. A persistent theme was the high level of support they received from nursing educators who were themselves responding to abrupt changes caused by the pandemic. Okay.
So yeah, and in terms of limitations to this, the scoping review, we really did not set out to actually assess quality, and we only searched English language papers. However, we did actually make an assumption that given the fact that the responses to the actual pandemic by educators was actually an emergency response in itself, we felt that the quality of the papers that came out were perhaps fairly lowish. You'd agree with that, Joe?
Yeah, one of the things that came out of the thing was that many of the studies felt repurposed, where COVID had been added on as a bolt-on to studies that were already about to be conducted or were convenient sampled very, very quickly from students who were at hand. And that for that reason, they tended to be largely descriptive, and the COVID wasn't really designed into most of the studies that we saw.
Yes, and of course, many of the studies were also comments, editorials from many educators, which really did not involve a lot of qualitative assessment or work, if you like. So that also added to the fact that it was clear that many of the responses were merely emergency responses rather than in-depth responses in terms of what was actually going on. And of course, there would not have been a lot of time to perhaps collect much evidence. Certainly from the UK perspective, that was quite obvious. That's right, Joe?
Yeah, there was only one large-scale study identified in the scoping reviews, and that was actually an international study of student nurses' tweets. whose most interesting finding was that British nursing students were far more rude about the responses, about the responses to the pandemic than almost anybody else. The significant finding for the OU, which we were quite surprised by how, was that studies focused almost exclusively on face-to-face learners on traditional nursing courses. Although many, particularly of the editorials we found, talked about the lessons to be learned in relation to blended or online learning, very, very few of the studies actually spoke about distance learners. They were only mentioned briefly in passing in 2 papers, and it was literally 1 sentence saying we should perhaps think about distance learners as well.
And this is sort of clear because, of course, the OU is perhaps one of the only of the very few distance learners learning institution in terms of nursing and nursing education. And it was really quite interesting to note that very few people had bothered to consider this or to explore this in any way. And that's opened up for us another area in terms of finding out from our students, because really our students' voices have been lost in the whole of this pandemic. We still do not know very much about how our students experienced this past pandemic, what impact it's had on them. Although there's been some literature to say that mental health has been quite highly impacted in other parts of the world, we still need to find out from our perspective how our students have actually been impacted, how they've felt supported, or what we've done well that's been able to support them. And we need to find out how we can actually use any evidence from that to inform future curriculum practice and planning. And that leads us into some work that we'll be doing. We've actually started doing some work to explore that with our students. Joe?
Yeah, this is in relation to a large-scale study of the impact of COVID-19 on OU student nurses and also student social workers across the 4 nations, which will involve a very large-scale survey followed by, I think it's 10 focus groups that are planned, so that we can, as I said, not just be descriptive, but drive down into some of the characteristics that might explain different students' responses.
Yes, and what we want to do is to try and find out specifically the students' experiences and how they were actually impacted by what happened. Now, we're actually hoping that this pandemic is now history, but we can't really be sure, can we? You know, so what we want to do is to see whether we can get in place some specific ways of ensuring that we can have something to work with in future if we have any issues that crop up in terms of how we deal with major infections and how the NHS and the government responds to them in terms of the work of the people on the shop floor level who provide the support to the services.